Okay, welcome everyone. Today I'm going to be talking about herniated discs. First, before I talk about the herniated disc, I'll talk about a healthy disc first so you understand what we're talking about. The disc is a sort of a spacer between the vertebral bodies all the way from the cervical spine, the top of the cervical spine down to the sacrum, between each individual bony vertebral body. The disc consists of essentially two parts, the outer annulus fibrosus and the inner nucleus pulposus. The outer layer, or the annulus fibrosus, is kind of like a radial tire. It's fibrous bands surrounding there that hold in a soft gelatinous material referred to as the nucleus pulposus. And the disc normally functions as a spacer and sort of a shock absorber between the vertebral bodies, and are able to flex and twist with motion, allowing you to turn your head up and down and back and forth, and giving some way and some flexibility to the spine as well. However, the disc can develop pathology whereby it becomes herniated, and herniations occur to varying degrees. You can have a herniated disc just slightly, or you can have a large disc protrusion or extrusion. A small disc herniation can be as little as where there's some tears in the outer layer or annulus fibrosus, allowing some of the nucleus pulposus to leak out into the exterior fibers of the disc and sort of bulge out slightly in an area of the disc, and where the weakness of the wall of the annulus fibrosus. As also, there can be complete failure of the annulus fibrosus fibers, where the disc material completely extrudes from the disc and into the spinal canal or neural foramen. If the disc does significantly protrude out or is extruded out into the spinal canal or neural foramina, you can end up with spinal stenosis, compression of the spinal cord, or you can have compression of a nerve root or multiple nerve roots if it's in the spinal canal, or just an individual nerve root if it occurs in the neural foramen. The nucleus pulposus is also very irritating to the nerves in general. So if any of the material does get out into the annular fibers and just to the very exterior, this alone can be very irritating to the nerves and cause radicular symptoms with burning and aching into an extremity. Similarly, if it completely extrudes, then of course, as I mentioned earlier, compression of the nerve root or narrowing of the neural foramen can occur, causing similar radicular symptoms, with not necessarily resulting in any motor loss, but certainly sensory symptoms. A herniated disc can sometimes resolve on their own to some extent, but never return back to a completely normal disc. The general treatment for a herniated disc may include rest, stretching, modalities, things like heat, ice, massage, as well as physical therapy, chiropractic therapy, epidural steroid injections, and at last resort surgery. The symptoms of a herniated disc can sometimes improve within a few days to a couple weeks to a couple months, or sometimes they can become persistent, thereby requiring more aggressive intervention as previously discussed.